When I was 27 years old, um, I had the initial surgery of my 8 surgeries, and a large part of my intestine was removed, and an ileostomy was created for me, which means that I wear a little bag attached to me, an appliance, which collects my stomach juices, and the diseased part of my intestine was actually removed, right? And in those days, this many years ago, 40 years ago, this was not a common surgery. It is a common surgery now, but it was not a common surgery. And I survived it. It took a long time for them to do this, and I survived it. I was in the hospital for a week, and every surgeon in the entire hospital came to see me, and to see indeed I had survived this surgery. There's only one problem with it. I was a 27-year-old single woman, and I couldn't live with it. And I became so profoundly depressed that I was suicidal. And I started saving the sleeping pills and the pain pills that were given to me every day, and thinking I would wait until I was discharged from the hospital. I would go home and take them all, because I felt completely separated from anything feminine or elegant from all other women my age. Now, in this week that I was in the hospital, I did not know how to care for my appliance, and a group of experts called enterostomal therapists came daily to change my appliance for me and help me. Right? These were all young women, the same age as I. And they would come into the room with their white coats, and they'd put on a mask, a gown, an apron, and gloves. Then they would remove my appliance, replace it with a fresh one, take off the mask, the gown, the apron, the gloves, and go to the sink in my room and very carefully wash their hands. This was not giving me a good feeling about the radical change in my body. It humiliated me, and it just made me feel ashamed. But towards the end of the week, a woman came in to do this for me, and she was late. It was almost 5 o'clock. She was dressed as if she was going to go out on a date. Another person my age, right? She's wearing heels and stockings and a twin set, because those were the days, you know. And she very pleasantly asked me, if she could help me. And when I said yes, she went to the sink in my room and washed her hands before she touched me. And she was not wearing, a white coat. She did not put on a mask or gown. In this very natural way, I think she commented on the elegance of my nightie. Right? We began talking, and she took an appliance from my bedside table and put it on me, removed the old one, put it on, with her bare hands. And I was a young doctor at the time. The first thought I had in my mind was how unprofessional. But she kept talking to me, and she was close enough to me I could smell her perfume, and she was wearing pink nail polish, and her hands were very gentle, and suddenly I could feel something come up in me, and I just knew that this was not going to be easy, but I could find a way to do this. I could make this all right. Even something like this was going to be all right. Right? Now, this woman did not give me back my intestine. Medical science can't do this, even today. What she gave me back was my life. Not because she knew how to cure me, but because she was willing to touch me.